A young doctor has just lost a patient in the emergency room. Their mind keeps replaying the same thoughts. I failed. What did I miss? Maybe I am not meant for this. A colleague notices. They could say, "Calm down. Stop blaming yourself. You did your best. Everything will be fine." These words may be well-intentioned, but to someone whose mind is overwhelmed, they may feel more like instructions than invitations, an expectation to think differently, feel differently, and move on. In intense distress, the brain responds to threat before it can fully engage with reason. Attention narrows. Thinking becomes harder. Even words can feel crowded. So the colleague chooses words that are simple and clear, delivered softly and slowly. They are not trying to change the doctor's thoughts. They are trying to make the immediate experience feel safer and more manageable. They begin, "I'm here with you." Then they ask, "Would you like to sit here or step outside for a short walk and some fresh air?" These words do not remove the loss, but they reduce pressure. They restore a small sense of choice. They make the next moment feel less threatening. This is safety. As they step outside, the colleague says, "You do not have to explain everything right now. Let's slow this down together." These words do not demand immediate control. They create space. They allow the body and mind time to settle. Rather than asking the doctor to calm down, the colleague creates the conditions in which calming can begin naturally. This is calming. As the immediate sense of threat begins to ease, the doctor asks, "What happens now?" The colleague does not give a long explanation. They do not try to solve the doctor's entire future. They say, "Right now, we will stay here for a few minutes. Then we can speak to the consultant together." These words make the situation smaller and more manageable. They communicate, "There is something we can do next, and you do not have to do it alone." This is self-efficacy and collective efficacy. Notice that the colleague does not remove the difficulty. They help make it manageable. The colleague then asks, "Is there someone you trust whom we could call?" The doctor does not know what to say. So the colleague offers a simple sentence. You could say, "I had a difficult night. Can you stay with me for a while?" Not the entire story. Not a perfect explanation. Just enough language to build a bridge to another person. When people are overwhelmed, they may lose not only their words, but also the ability to initiate connection. Sometimes, borrowing someone else's words is enough to build the first bridge. This is connectedness. Later, the doctor says, "What if I'm not meant to be a doctor?" The colleague responds, "You do not have to answer that tonight. This one painful outcome does not have to decide your whole future. For now, let's take the next step together." This is hope. Hope is not saying, "Everything will be fine." Hope acknowledges the pain while keeping the next step and the possibility of a future within reach.
Safety. Calming.
Self-efficacy and collective efficacy. Connectedness.
Hope.
These moments reflect the 5 essential elements described by Hopeful and colleagues. They are not 5 perfect sentences to memorize. They are 5 functions that language can serve. Words can reduce threat. Words can lower pressure. Words can restore choice. Words can strengthen connection. Words can make the next step possible. This is why language matters. The same situation can be made heavier by saying, explain everything. Or made more manageable by saying, start with what feels most urgent. It can be made more isolating by saying, you are a professional. Learn to handle this. Or more supportive by saying, we will take the next step together. It can be dismissed with, you'll be fine. Or met honestly with, I can see that this is difficult. I'm here. The difference is not simply which words sound kind. The difference is what the words do. Do they reduce threat? Do they preserve dignity? Do they restore agency? Do they help the person feel less alone? Do they support the next safe step? At Augmenta Health, we call this WORDICINE. Words offered with the care, purpose, and precision we associate with medicine. Not because words alone can treat a crisis. Not because they replace medical care, mental health care, professional judgment, or emergency action. But because the right words, offered in the right way and at the right time, can change what happens next. Every word is said. But when words create safety, calming, efficacy, connection, and hope, what is said becomes what can aid. One calm tone. One respectful sentence. One safe next step. That is how language becomes first aid.